Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important topic called as PCOS and how it affects the fertility. So the reason why we are discussing about this topic is a lot of clients who are coming to our clinic are questioning us about the fertility issues. Many people who are already married or people who are getting married are worried if they will be able to get pregnant and have a safe pregnancy. So in order to answer all their queries and also to educate people, we are doing this video. So let's dive into the video to know more about it. PCOS and fertility. Does PCOS really affect the fertility? Yes, it does affect fertility. It affects fertility by three main spheres. The first one is high androgen level. As you can see, PCOS has higher androgen levels. Apart from that, the second sphere is anovulation, that is lack of ovulation. If there is no egg for the sperm to be fertilized, there's no point in this whole thing, right? And also the third thing is that it is a chronic condition. It's chronic in nature, it has anovulatory cycles, and also it has high androgen levels. These three are the main spheres in which PCOS affects fertility. So how does it actually affect, or what is the pathology that's run behind? Let us see as we go through further into the topic. Now let us know what are the signs and symptoms of PCOS so that we can understand this fertility issue in better aspect. The first one is irregular or absent periods. You might be feeling that if you have PCOS, you might be having only late or delayed periods. That is more characteristic of PCOD than PCOS. In PCOS, you will be having irregular periods. That is, you can have period either in every 10 days, either every 15 days, every 45 days, and sometimes it is 10 days, sometimes it's 45, sometimes it's 6 months, sometimes it's 2 months. So it's very irregular in nature. So that irregularity is also the basic factor why fertilization is an important concern in people who are suffering from PCOS. And apart from that, high androgen level can cause male pattern baldness and also hirsutism, which is excessive hair growth, not here, but excessive hair growth in unwanted places like your chest, on your mustache, or on your side locks. And then acne and oily skin and obesity or weight gain. Obesity and weight gain can trigger PCOS, and PCOS can maintain this weight gain. And people who are suffering from PCOS find it very hard to lose weight. So if you're someone who doesn't know if you're suffering from PCOS or PCOD, we've already made a video on that. We will be providing the link in the description box. You can check it. And it is very difficult to conceive. So how is it difficult? Let us know. The first problem that arises is hormonal imbalance. In the hormonal imbalance, we have to talk about the rising androgen level, the fall of follicular stimulating hormone, the fall of progesterone, and the rise of luteinizing hormone. So just let us see basic pathological outline how all of this is happening. Now let us see the pathology. If you see here, this is brain. In the brain we have hypothalamus, right? The hypothalamus is supposed to release GnRH, which is responsible for triggering the pituitary gland to release LH, luteinizing hormone, and FSH. This LH and FSH will trigger some follicles in the ovaries, and some follicles will start to mature. 6 to 8 follicles are released after LH and FSH trigger, and in that one will become the dominant follicle, and the dominant follicle will release the egg. And these follicles, while they are maturing, they release estrogen, and after the release of the egg, these follicles will become corpus luteum, which will release progesterone. This progesterone is in turn helpful in maintaining GnRH. What happens sometimes, we do not know what the exact etiology or the cause is. The GnRH pulsations, and when GnRH is increased, LH will rise abundantly and FSH will fall. LH and FSH should be in 1:1 ratio. Sometimes what happens, because of this GnRH issue, LH will start to rise a lot, and rise in LH will cause thecal cells to proliferate, and this thecal cells will release androgen hormones, that is testosterone. And apart from that, the follicle stimulating hormone is lesser in quantity. That is why there is no maturation of the follicles. Whenever there is no maturation of the follicles, what happens? There is no release of the egg. So if the follicles are not maturing, the egg is not released. If the egg is not released, then you cannot get pregnant. Apart from that, if there is no maturation, there is no release of egg, right? And if there is no release of egg, there is no formation of corpus luteum also. If the corpus luteum is not there, then the progesterone is also not there to this progesterone will which will again monitor the GnRH. So GnRH is increasing rapidly without any monitoring of progesterone. So this is a cycle, and whenever there is increase of this androgen hormone, the girls will develop mustache, side locks, beard, and hair on the chest also. So this is the whole pathology that is running inside PCOS. So what you will understand: rise in GnRH, rise in LH, fall of FSH, fall of progesterone. This is very, very important. Then what is the other factor that is important in discussion of this fertility issue is anovulation. As we have already discussed, there is hormonal imbalance, and because of this hormonal imbalance, because of the low FSH level, there is no release of egg. So whenever there is no release of egg, there cannot be fertilization. And also, after using some medication, some people will have ovulatory cycles, but because the period is irregular in nature, for example, if this is the first day of menses, and then from that day to 14th day you have ovum releasing, but here because the PCOS is very irregular in nature, sometimes the bleeding is for 10 days, sometimes the bleeding is for 3 days, sometimes the bleeding does not appear for 6 to 7 months, so we do not know when the egg is actually releasing. So that is why you can have fertility issues even here. Apart from that, we will have fertility issues, and also even though if you are fertilized, that is even though if the fertilization takes place and you are pregnant, you have to understand that they have insulin resistance as well as oxidative stress and metabolic issues. That is, people who are suffering from PCOS can suffer from hypothyroidism, can suffer from diabetes mellitus, and also people who are suffering from diabetes mellitus when they are conceiving or when they are pregnant, that can have an effect on the baby leading to some complications. That is also very, very important. And apart from that, you will have, even though the egg is releasing properly also, there can be issues in the quality of egg for fertilization. Even though the egg is releasing, if there is no proper hormones to maintain and for the maturation of the egg, even though if the egg is released, the egg is not proper in nature. That is, quality of egg is also very important for fertilization. So if the quality of egg is not good, then that can lead into miscarriages or some problems during pregnancy. Then even if the egg is released, even if the quality of egg is good, you have to remember there is another issue in PCOS, which is endometrial thickness. So what is endometrial thickness, and what happens is that, as you know that people who are having regular period, the endometrium will start shedding during the period and again reforming after the period. But what happens if you have irregular period? There is irregular shedding of the endometrium. Sometimes it can become very thick because there is no period or menstruation to control it, and sometimes it can become very thin through excessive bleeding. So all of this can happen. Even though there is fertilization in the fallopian tube and the zygote is formed, it should come and get attached inside the uterine cavity near the endometrial layer, which should be able to supply and support the growing pregnancy. But what happens is that sometimes because of this irregular period, this endometrial layer can vary in thickness and can lead into, even though if you're you got pregnant, it can be the reason for miscarriages in PCOS. Apart from that, people who are suffering from PCOS can also suffer from inflammation and oxidative stress. So in inflammation, certain chemical mediators are released, which is not good for the baby. It can cause autoimmune diseases in the maternal aspect, and also it can cause autoimmune diseases in the future for the baby who is forming in the womb. So that is also very, very important. So what about inflammation and its oxidative stress? If you want to know that in detail, we will be doing a video on PCOS and inflammation and oxidative stress. Do check out our future videos. If you want to control and have good outcome of pregnancy, the first thing that you have to do before getting pregnant is having weight management. Control your weight, eat properly, exercise daily, eat foods that are less in glycemic index, and then anti-inflammatory fruits, so that they will calm the chemical mediators. Reduction of stress is very important, as this can create happiness in the body, which can create good and better egg quality outcome. And also maintain proper natural ovum induction methods, like from the first day of your period to the 14th day, consume chia seeds and flax seeds, and then from the 14th day to the end, until your period appears. Consume sesame seeds. It will naturally regulate your ovum. And apart from that, try using medications which are good and safe and effective like homeopathy. Now coming into the conventional form of treatment or allopathic form of treatment. If you're someone who's suffering from PCOS, they will be giving you, that is allopathy doctors will be giving you hormonal contraceptives. If you're using contraceptives, then it is hard to get pregnant, and they in turn have some side effects like weight gain, acne, hair fall, hair issues, skin issues and other issues. So apart from hormonal contraceptives, they can give you metformin, which is for your glucose monitorization. Of course, metformin is the major drug people are using these days, but remember it has side effects like it can deplete your muscle, and whenever there is depletion in the muscle, you can understand that the glucose spike will start to rise. Even if you're using metformin for a longer period of time and then you're not finding a controlled state, it is because the muscle layer is getting depleted. If you have a good muscle layer, or if you're using metformin, do understand that you have to do muscle building exercises so that your muscle keeps that form and shape, because muscle is important to consume the blood glucose level. And also anti-androgen hormones, which are for maintaining that androgen level in the body. And also there are medications to induce ovulation. Apart from all of this, if you stop using these medications, you can have intermenstrual bleeding, and also the symptoms can reoccur. And also it is sometimes, even though if you're using all of this, it is hard to get pregnant even after you have had a baby during your PCOS also. The second pregnancy also, if you're planning, it is hard to get that, or if it is hard to conceive using allopathic form of medications. Even though you're using allopathic form of medications, after stopping you can have intermenstrual bleeding, and also the symptoms of PCOS can return. But there is some sort of medication which is safe, effective. And remember, you have to consult a trichologist for your hair, a dermatologist for your acne and oily skin, a gynecologist for your hormones. Apart from that, for the general inflammation, oxidative stress, you have to consult MD, general physician, all of this. Apart from that, even your mood swings, you have to consult your psychologist. So there is a sort of medication which will cover all of this. That is nothing but homeopathic form of medication. If you're someone who's planning for pregnancy, if you want a medication which is safe, which is holistic in nature, which will improve your fertility chances, which will not give you any sort of bad side effects, which will improve your overall immune system, decrease your oxidative stress, maintain your hormone, and even though by mistake you skip for 1 day or two, you should not be experiencing any mid-menstrual cycle or mid-menstrual bleeding. And also it should be able to maintain and balance out your hormones, so that after the completion of homeopathic treatment, there should not be any sort of recurrences. So the recurrence rate, if compared to allopathy, in homeopathy is very less. So the repetition of symptoms are also very less. The outcome is more. It is better. It is safe. It is effective. It is holistic. It is understanding you as a person. From where did the stress start, or from where did the problem start? How is it converting? How are the symptoms? Why are the symptoms changing sometimes? You have to understand the person, and that deep insight is present in homeopathy, which will be able to prevent further recurrences, relieve your condition, and cure your condition. What happens if you neglect PCOS? PCOS is not just a female reproductive organ disease. It's an endocrine disorder which can have effect on your whole body. It can have effect on your metabolism. It can have effect on your thyroid. It can have effect on your insulin levels, and also can bring out some autoimmune diseases also. So if you're someone who is suffering from PCOS, try opting for homeopathic medications and take doctor consultation as soon as possible, so as to have a better and a good prognosis for this disease. Do not neglect PCOS, as it can cause multiple organ problems, and it will be really hard after the multiple organ problems have arisen. It will be literally very hard to cure. It will take a lot of time to cure the case. So if you're approaching us during your starting period, it will take little lesser time period to cure you. But if you're someone who is approaching us with multiple problems, then it will take time for homeopathy, because it's timely in nature. It will act according to the given space, given to the according symptoms and all. So it can take, if you're someone who's suffering from multiple problems along with PCOS, it can take a period of time for you to get cured of your disease. We have discussed how homeopathy is a better option for PCOS. In homeopathy also, Fidicus homeopathy gives you a better chance for healing. Here we have online consultation options and offline consultation option. If you're someone who's staying near the nearest branch of Fidicus, you can contact us offline or come and visit us in person. And if you're someone who's staying far away from us, you can contact us online either through audio or video consultation. After the doctor consultation has been done and the investigations are verified, after doctor consultation and after the investigations have been verified, the medicines will be sent to your doorstep, especially for online clients. If you're staying in India, 3 to 4 business days, staying in USA, 3 to 5 business days. Apart from that, anywhere else in the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're someone who would like to get in touch with us, you can contact us on this number, call us, WhatsApp us, or messages on this number. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have discussed how homeopathy is a better option in curing PCOS. If you're someone who is suffering from PCOS, PCOD or female reproductive related diseases, understand that Fidicus Homeopathy is a top notch in curing all of this, because Fidicus Homeopathy stands for highest chance of health. Here, we are already treating patients who have PCOS, PCOD, endometriosis, adenomyosis, bulky uterus, and good number of fibroid cases, and also infertility cases. So, we are having good success in all of these cases. And also, the treatment is transparent, which means there is no gray area between the patient and the doctor. The prognosis will be clearly explained to you. And the personal care here at Fidicus Homeopathy is top notch. We will be bursting all of your myths and educating you on any of the doubts that you ask us. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.